Okay, good morning, everybody. We're going to go ahead and get started. It looks like people are still joining us and will probably still be joining us for the next few minutes, but we'll go ahead and jump in since we have a full program today. So welcome everybody to our February Utah Children's Care Coordination Network meeting. Just a few housekeeping things. We'll start with some announcements. We have an autism mini module that we're going to have hear from Sylvia Barragon from UDAC. And then we'll jump into our learning session, which is all about motivational interviewing today. If you have a chance, we'd love to have you rename your Zoom profile. So up in the upper uh, right-hand corner of your picture, if you hover over it, you'll see three dots. And if you click on that, you'll about halfway down, you see an option to rename yourself. We'd love you to include your first name, your last name, your agency, and your role. It helps us keep attendance for this meeting. Otherwise, I just get sometimes initials or first names only, and I don't know who's joined us. So we'd love to have you rename your profile. Also, if you're joining our meeting for the first time, we'd love to have you put your name in the chat along with your email, and that will get you added to our listserv and the monthly meeting invites as well. So I don't have any announcements. I will open it up and if anybody else has anything that they want to share for announcements today. You can raise your hand or just unmute yourself and chat or put it in the chat as well. All right, I don't see any announcements, so we'll go ahead and turn the time over to Sylvia.
Oh my.
It looks good, Sylvia. We can see your screen.
Can you hear me?
Yep.
Okay, perfect. Thank you. Thank you so much. Good morning, everyone. My name is Sylvia Barragon, and I'm the nurse care management from the University Developmental Assessment Clinics. And this morning, I will be sharing wandering and elopement behavior in children with autism, as well as some safety resources. Wandering and elopement events are where a person who requires supervision to be safe leaves a safe area or the supervising person and is exposed to possible harm or injury. These potential dangers include environmental hazards such as water, traffic, terrain, and weather, or encounters with predatory strangers. Nearly half of children with autism elope, and more than half of these go missing. Almost half of all children with ASD attempt to elope at least once after the age of 4. Children and teens with autism may not always recognize social rules or community safety expectations. They can also act impulsively or become focused on certain terrain, certain interests, which lead them towards dangerous places like waters or busy streets. Some children wander because they are trying to get away from something that feels stressful or overwhelming, and others may be trying to escape uncomfortable sensory experiences such as loud noises or crowded environments. Prevention is the most important intervention for elopement. Consistent, adequate adult supervision is important in all environments, including school, home, and community settings. Prevention strategies families can implement include securing the home, outdoor gates, garage doors, the use of simple window and door alarms, identify and address triggers, teach safety coping and pursue forms of communication, enroll in swim lessons, provide safe space escape alternatives, secure wearable identification and or locative technology, alerting relatives, schools, and neighbors, as well as local first responders. Parents should also request an adjustment to an individual education plan to address wandering and elopement behaviors and set up a plan if the child leaves the classroom or school grounds. Here are some interventions as well that can be implemented. Parents can work with their child's ABA provider to work on behavioral interventions. And then again, consider tracking and technology along with preventive strategies for chronic wanderers. Drowning is a leading cause of injury-related death among children with autism spectrum disorder. Many are drawn to water for sensory reasons and lack of safety awareness. Safety strategies that can be implemented include installing fencing with self-lock gates around residential pools and, if possible, natural water sources near the home. Provide one-on-one constant and proactive supervision when near water. Specialized swim lessons. Inform their neighbors about their child's tendency to wander. And in the event a child with autism is missing, search nearby water sources immediately. In this slide, I have included some types of facilities that offer swim programs, such as the YMCA or their county rec centers that offer adaptive swim for children with developmental or physical needs. Other local examples include the National Ability Center and private programs such as Swim Kids or Goldfish Swim, which also have inclusive programs for children with special healthcare needs. Additional resources for families include adaptive car seats and medical strollers. So it's important that as care managers we understand their benefits and health coverage for these type of services. They would need a referral from either their MD or the provider that's seeing them. Then a physical therapy or occupational therapist will complete the seating consult, make their recommendations, and submit that to the insurance for prior authorization. I know Intermountain and National Seating and Mobility will schedule the seating consult at a facility closest to the patient's home. And then once it's submitted, if for any reason it gets denied, another great resource is the Shriners Hospital for Children and Wheelchair and Seating Services. It's the only, and I believe I mentioned this, but it's the only clinic within Shriners that will see a child without an orthopedic diagnosis. So they will see one of their seating specialists, if they need an adaptive car seat, make the recommendations, provide them with a loaner with the adjustments that have been made for the child's needs. And then if for any reason the prior authorization is denied by the insurance company, they will allow the family to keep that loaner. And if it's approved, they'll have the family come back and just swap out the car seats. Another resource for our families that we provide within our clinic is the DMVTC 842 Disability Certification Form. So our children with autism, or those that tend to be wanderers or runners, we provide the families with this form signed by your physician. They submit it to the DMV, and we haven't had any issues with being able to access a disability place card. And I've included the file here, the link for the form itself. I also have the contact information for Intermountain Wheelchair, National Seating, and Shriners that we can provide to everyone. Other safety products and services include wearables, which could be identification bracelets or identifications that they can be placed on child's shoes. Alert Me bands is one of the only bands that are adjustable and are the only solution available to date that are nearly impossible for children to remove on their own. Because our ASD patients are even more at risk for wandering, they especially need to be wearing something like this at all times. I included also the Autism ID card that can be downloaded online. They start off at $3 with all of the patient's information, that whether the family can carry it or the child can carry it in their backpack as well. And then tracking devices such as SafeWise and AngelSense. These are electronic tracking devices that families can access. However, they do require a monthly plan to be able to use these, and I haven't found any luck whatsoever finding an insurance plan that will cover these services. So these are an out-of-pocket expense for our families. Um, and also, another resource is a big red safety box. This one has a lot of educational material and tools for families, such as a caregiver checklist, family wandering emergency plan, first responder form for them to complete, profile form, wandering prevention brochures. It also has some sample IEP letters. I've also included a family wandering emergency plan, a link here for to share with your families, and a sample IEP letter to address wandering at school. We have some additional resources here for our providers as well as our families. And thank you, everyone. Just always remember to inform our families that no one knows their child's unique personality, needs, strengths, or challenges better than they do. And whether they're working with teachers, doctors, therapists, or anyone else, their insights are always valuable. And here are the references for the slides used today.
Thanks, Sylvia. Somebody had mentioned whether or not the slides would be shared. I just included in the chat the link to our public Trello board where we post everything from the meeting. You can download slides there. You can watch the recording. There's links usually to all the resources mentioned as well. So make sure you go check it out, and you can see past meetings as well. All right. So thank you, Sylvia. We'll move on to our learning session for today, which is about motivational interviewing. And while Aaron is getting his screen ready to share, I'll go ahead and introduce him. Aaron's an assistant professor at the Utah State University, and he completed his PhD in public health at the University of Nevada, where he specialized in environmental and global health. He's a researcher and lecturer with backgrounds in social or substance use disorder, mental health, maternal child health, HIV prevention, global health, and nutrition. And we're excited to have him here today for this training.
Great. Thanks for having me, everyone. Thanks for coming to this meeting. Sorry, my internet's a little slow. All right, so today I'm going to host a training on motivational interviewing. This can be for anyone. And we're going to focus on vaccines, but you can use this for any behavior change, let's say diet, substance use, exercise, whatever you're working with. If there's a behavior, this will be helpful to improve likelihood of behavior change. So that's what we're going to talk about. This presentation, training materials, we had a grant through the Excite Foundation, and we worked with Washington State to put all this together. Nothing to disclose. So I'm going to put in the chat, if you have time, or if you can just at least complete some of this pre-survey information, even if you just put your county, it's useful for our grant reporting. I just put that in the chat. You can click on that link, and it's totally optional, but it's useful to us. Okay, so we can get into this training. So I'm going to go through some background on current state of vaccine hesitancy, our current measles outbreak, but then we're going to jump into why should we use MI, how can we use it, what are the skills we need, and then I really want to talk about one tool I think is the most useful takeaway from this is the ask, offer, ask. So we'll get to that. So I did want to kind of set the setting of the United States right now, and especially Utah. So we're going to go through some data really quick. So since COVID, you see this dip in 2020, 2021, where our school exemptions for vaccines started to increase, and they're still increasing, especially in rural and frontier counties. We want to keep this below 5%, but we have about 10% rural, 9% in frontier, and 6, 7 in our urban counties of kindergartners that are not fully vaccinated. It's the same, seventh grade isn't as high, but kind of the same trend. We're seeing increases since COVID. This is the most recent data where they removed online students to get a better picture. And you can see our exempt rates is about 9% overall. Um, so the point is there's more hesitancy. Parents are questioning and filling, getting exemptions, not getting their children adequately immunized. Why is this important? The majority of these exemptions are personal, so about almost 85%, which means they might be open to changing their mind. The medical, the religious exemptions, those can't be changed. We shouldn't try to change those, but the personal, this is the group we want to work with, try to give them more information, but how can we do that effectively? That's what we're going to talk about. So I just also want to set the setting on trust of experts, science, medicine in the United States since COVID, since it's been damaged a lot by the pandemic. So I'm going to go through a few polls here from Kaiser Family Foundation, just looking at trust overall. And most of you work in medical field. The good news here is that doctors, medical experts, nurses, you're still the most trusted expert that people look to for health information. So pretty high trusted, CDC, all these other things. It's confusing. People have different feelings on all that. This is the same thing, but who's your most trusted source of vaccine information? The pediatrician still number one, which is good. The public health department is number two, which this has increased. It was lower, it's going up, which is good to see. Again, people aren't hesitant about older vaccines, not as hesitant or worried compared to flu and the COVID vaccine. So, like old polio, the MMR mostly, even though we're seeing hesitancy, hepatitis B is getting more confusing with people with the new schedule changes. But overall, people do kind of see the value of vaccines, especially for like polio. So they're open to, learning and understanding the benefits of these vaccines. Just a couple more background slides. So social media or just all the information people are exposed to now, it's hard to control what people see, and there's all kinds of different data out there, and especially on social media, people are going to be in these silos where they're exposed to certain things based on their algorithms. And anyways, about half of adults are using social media to find health information. So a lot of this can be mixed. Some of it can be correct. Some of it may be misinformation, disinformation, but about half. And, younger people have the majority of younger kids. So they're even higher than half, right? So they might be exposed to more misinformation. And then looking at what the top health topics they see on social media, vaccines is in the, top three things they're seeing. And then the more people use social media, the more they're likely to believe misinformation, which isn't, especially this is COVID related misinformation. I just put this in just so if you are into monitoring trends, alerts, the Public Health Communication Collaborative, PHCC, they put out these alerts that you can keep an eye on. I just search for MMR, but they do all kinds of alerts that you can look at. This is a really busy slide, but it's just showing how common people think these false, misinformation is true. So the MMR has been proven to cause autism, about 24% true. Measles vaccines more dangerous than actually getting infected, about 20%. mRNA vaccines can change your DNA, about 30%. And then the Tylenol increases risk of autism, about 34%. So just showing this misinformation is impacting the way people think. Okay, I'm just going through this really quick. So now we're in this environment. We have more hesitancy among parents, more exposure to misinformation, disinformation, more, lack of trust of medical health, public health experts. So this all coalesced post-COVID, and it's resulted in an increased risk for infectious disease outbreaks. And we're seeing this in a lot of states. South Carolina has a bigger measles outbreak right now, but the one in Utah is still going. Um, it's still active. I pulled this data on Monday, and I live down in St. George area. That's where most of these cases between us and Arizona. But this is still an active outbreak. You might see measles cases in your clinic. So all of these factors I just laid out have contributed to increasing the risk in making these outbreaks last longer, et cetera, et cetera. So yeah, the current week we still had active cases this week. I just am sharing this slide. So I really like the Public Health Communication Collaborative's resources, and I'll share all these slides in our materials. You can click on this link if you want to see I just like the way their communication materials are put together. So take a look at that if you're interested. Okay, so we touched on some of these key drivers that are impacting hesitancy, the misinformation exposure. Another one is the trust, which we touched on, but the politicization of science. And it's just getting more confusing with changes at CDC, to the vaccine schedule and the messages they're putting out. People don't know who to trust anymore or which schedule should I follow. It's just a confusing time, so it makes people more hesitant. There's always access cost, those normal barriers to our healthcare system, insurance costs, transportation, all those types of things. But one that maybe you all can think about at your clinics or wherever you're working is kind of having a universal, clear recommendation for vaccines. It can remove what's called a provider gap. Um, uh, if every provider has different things they recommend, it just makes it more confusing for patients. Or if the nurse says something different from the doctor and the MA says something different from the nurse, then people are going to be more confused. You have to have a clear, consistent kind of recommendation or message that people hear over and over. And then cultural norms, religion, cultural background, all these things also impact what people believe and all that. Okay, so now I like to go through that data just to kind of set the background. But okay, we're at this point in time where people are less sure of the benefits of vaccines, and they're more afraid of the adverse health outcomes, whether they're real or not. So kind of the point I want to make is these parents, they are hesitant because they think they're doing what's best for their children. They don't want their child to get autism. Even if these aren't like really linked, scientifically, if they believe there's a risk, they're going to be hesitant. If they're worried about, myocarditis, the heart inflammation for their teenagers, they're afraid of these things they're exposed to. And when I do these trainings in person, you can just put yes or no in the chat. Like, how many of you, we just had a presentation on autism. So how many of you have worked with a patient or at least interacted with a person with autism? You can put yes or no in the chat. I imagine almost everyone will put yes. And then how many of you have ever seen a case of measles? And it's probably very few of you. Maybe you have this year, it's not very common. People don't see it. So vaccines are kind of suffering from their success from the past, 50, 60 years. People haven't seen a lot of these diseases. We're all doing this math in our head of risk and benefit and all this. And parents, unfortunately, just due to our psychology and these other factors, they're weighing the risks, even if they're not real, the perceived risk of my child getting autism or side effects, anything, is outweighing the benefit of actually getting the vaccine for a lot of these parents. They don't want a measles outbreak. They're not like horrible people. They're not purposely trying to, increase risk and all these things. So we need to come from that mindset that they're trying to do what's best for their kids. Let's meet them where they're at and try to help them the best we can. And how are we going to do that? We're going to use motivational interviewing. So I'm guilty of all these things. So what have we tried in the past? I just threw all this data at you, right? I love to look at epidemiology reports, all these data, but when we just throw all our science and facts and try to prove people wrong or convince them with our facts, persuade them, it doesn't work. When we try to debunk all their myths, you know, point out the flaws, oh, the disease is much worse than the vaccine, the risk of side effects, point out that flaw. You don't want your kid to actually get measles. They could potentially die. It doesn't work. None of these things work. Trying to shame people. Like I work in substance use a lot, and people are always like, because it's very stigmatized. Oh, if you really cared about your kids or your family, you would quit using drugs. But it's obviously, if that was true, everyone would quit. It doesn't work like that, right? But we do the same thing with vaccines, whatever, try to shame people. Anyways, all these things do not work. I'm guilty of doing all these things, but we need to try to put pause on this and do something, quit spinning our wheels, and try to do something that will be more effective. And really, what can we do? We're gonna do motivational interviewing. And none of us, this is like a 40-minute presentation. You're not going to become an expert. So don't kind of worry about therapists, counselors. They're the experts in this. But we all can take a few key things from MI and start doing it in our practice when we're working with people, to build trust and to increase the likelihood that a person will change a behavior. And that's how MI works. We're going to meet the people where they're at. We're going to ask them a lot of questions, how we can help them. And over time, I really believe if everyone, we can start trying to integrate this into our practice, those trust numbers will keep going up. And over time, people will consider adopting healthier behaviors. So I like to put this quote in here. Everyone's probably heard this. You can lead a horse to water, but you can't force them to drink. It's the same with patients, the public, whatever you're working with. You can't make anyone do anything. We can give them all the information, all these things, but they need to come to the decisions themselves to get their child vaccinated, to change their diet, to stop using drugs, alcohol, whatever it is. So yeah, we're not going to force people, right? And the magic of MI is we really want to ask a lot of questions so people can come up with their own reasons to change. So you're going to talk, it takes a little bit longer, but we want to ask them, engage them in a conversation that helps the person identify what are their barriers, what can help them, what can motivate them to actually change a behavior. This could be diet, like any behavior change. That's the whole point of this. We're going to talk through so they can come up, oh, because every person's different. One person might want to get vaccinated because, maybe that would save them money, or, maybe they're really worried about measles now that there's an outbreak. Whatever. Everyone's reasons to change can be a little bit different. And that's why we have to talk to everyone, ask a lot of questions. So MI has been used in a lot of different behavior changes. Like I said, these are just from some systematic reviews showing the impact. And overall, you can read through this, but MI seems to have, small or moderate outcomes over the short term. That's what the evidence says. So it's worth using. Longer term behavior change is harder to do. So over the short term, though, this is why it's very useful for vaccines. You kind of have to do it, once a year or every few years. Um, the short term, moderate term, or medium term, it's pretty effective. Okay, so how do we do MI? We're going to go through all these key skills here now. But the acronym is ORS, and the magic, the most important thing is asking open-ended questions. We're going to go through the rest of this. The two things I want you all to take away is just ask more open-ended questions, and then we're going to go through this ask, offer, ask. But I'm going to go through all the steps just so you understand the whole process really quick. But again, the two key takeaways are more questions, and then we'll go through the tool here. All right, I'm going to play a short video just to give you an overview of the whole process, and we'll keep going through here.
Why don't patients always do what we tell them to do? Well, because we humans are human. We make decisions based on wants, needs.
Can you all hear this? I forgot if I shared the sound.
Yes, we can hear it, Erin.
Oh, okay.
The way we feel, or habits. We're curious creatures. We like to figure things out for ourselves. Remember when you were a kid? Don't touch that only made us curious. Because I said so didn't work so well either, because it didn't answer any of our questions. Talking at people and expecting them to change simply because you told them to change is called the directive approach. In a clinic setting, it sounds like take that and watch this. These one-sided conversations can cause a patient to shut down. So how can we get patients to change their behavior? One technique is motivational interviewing. Motivational interviewing is a collaborative conversation strategy that focuses on listening and guiding a patient's curiosity so that they find their own reasons to change a behavior. Here's how it works. The first letter of each step spells ORS. Open-ended questions help you get to know your patient. What do they already know? Ask if you can offer solutions. How do they respond? Affirmation of past efforts builds confidence in their ability to change. Reflective listening demonstrates empathy, interest, and understanding. It helps clarify and explore reasons for change, and also to provide affirmation. Summarizing ensures a shared understanding and reinforces key goals. Instead of being the expert, be their guide. Don't assume they are uninformed. Trust that they want to make the best choice for their health. Avoid scare tactics. Instead, help them explore the pros and cons, the barriers they see, and how to move them toward making a change. Always remember to reinforce or recognize any positive change in the patient, even if it's a small one. If a patient is still not ready to make a decision, let them know you're available to continue the conversation anytime. By working at a free clinic, you play a very valuable role in people's lives.
All right, I like that video, just quick overview of the whole ORS process, but we're gonna just back up a little bit before we'll go through some examples of all the ORS. So the first thing we want to do is from now on, all of our spirit animal is Curious George. We want to be as curious as possible. This aligns with the ORS, open-ended question. You want to be curious about why your patients, clients are acting the way they do and what are the barriers. How could they change their behavior? Again, this applies to any behavior change. You want to learn what's driving it and what could potentially help them, motivate them to change. So we just need to start to ask a lot of questions. So let's say a patient says, I heard the MMR vaccine causes long-term problems. Let's say they said it causes autism, whatever they say. Normally we want to throw a lot of data at them, right? Oh, there's all these studies showing it doesn't cause autism, the side effects are super rare, whatever. We want to say that right away, but that doesn't work. That just turns people off. Instead, we want to get curious. What worries you most about the vaccine? Where'd you hear that? What would help you feel safer? And again, I know you're all super busy. Based on your time, just try to ask a couple questions. We're going to get into this a little more. I do want to point out, because this has come up in the training a lot, is you don't have to agree with your patients. If they're believing misinformation, um, you don't have to say, oh, you don't have to agree with them is the point. You don't have to endorse their behavior, what they're saying. We just want to disagree respectfully. So there's some examples on here, and we'll get into this a little bit, but I don't see it the same way, but I want to understand. We may not agree, and that's okay. I'm here if you want to revisit this, just whatever it is. The point is, you don't have to agree with what they're saying. So we're going to be curious. Curious George, spirit animal. The next thing is we just have to have a little more empathy. A lot of healthcare, public health workers, they have burnout, compassion fatigue from COVID, and our healthcare system isn't the best thing to work in, and there's all these things. I'm sure you're frustrated hearing things over and over. And I respect what you all do. It's amazing, needed work. I totally could understand how frustrating it could be, but we want to try to be as empathetic as we can in all our conversations to start rebuilding trust. So really just try not to judge people, walk a mile in their shoe type of thing. So just think about this as I read this little scenario and how you would feel and what you could do as a clinician or working with this family to show empathy. So basically, you're a parent, you're feeling conflicted about the MMR vaccine. Don't want your child to get measles, but you're scared of autism because a trusted friend's child was diagnosed and they believe vaccines played a role. You really trust your friend and you feel anxious, but want to make the best decision. So that's maybe this happens in your clinic. So you don't know any of this background, right? The parent comes in, they get in the waiting room, and you just go, "Oh, your child's due for your MMR vaccine." And then maybe the parent says, "Oh, I'm worried about autism and these side effects." And again, our instinct, because we're busy, we want people to make informed decision, is we want to give them the correct information, right? We want to say, "Hey, your beliefs, that's not true. There's scientific studies that show the vaccine's safe. You're really putting your child at risk. There's a measles outbreak. Here's a flyer. Will you change your mind?" Whatever you do. So how would this make you feel? You can put this in the chat, but just to be fast, I'm going to go through this pretty quick. Obviously, it would make you feel like they're not listening. They don't really care what you think overall. If we jump immediately into disproving her thoughts, her fears, instead of engaging and being empathetic, that's horrible. If she told you that their friend has a kid with autism, they could just be like, "Oh, it's normal to have concerns and be worried about the side effects. It could be scary." You have to engage, and we're going to get into that. Again, we don't want to jump immediately into shoving information at people or correcting them like that video said, and I'm repeating. And this slide is the same thing. So there's this thing, it's called the writing reflex. It's the, whatever you want to call it. It's where, I've been saying this over and over, where we immediately correct or misinformation or tell people what to do. So the HPV vaccine is only for sexually active people. So writing reflex, you want to jump in. That's not true. It does all this good stuff. It prevents cancers. We want to go into our little spiel right away. Like, we don't ask them a question. As soon as they say something, we say the opposite thing. So we're kind of having a debate, right? That's what it feels like to the person. You don't actually care what I say. It's my side versus your side. You're not listening. I don't feel heard. I'm not going to engage. I'm not going to listen to you because I don't want to debate you. I came to, again, I'm trying to do what's best for my child. So something better to say could be, oh, you're concerned about the HPV vaccine. It might not be necessary right now. Can you tell me more about what makes you feel that way? We want to engage. We want to learn. Remember, we're curious. Why do they think that, you know, it's only for sexually active people, or it's not right for their child, whatever it is. So um, this is if you can just try to pause, listen, and ask a question before we start throwing information at people, it will be much more effective. So I just want everyone to think, what are the three hot button issues, or two, maybe you only have one, where it's really hard for you to not go into that automatic response. Here's the science, or correcting or telling people what to do. Just try to be more aware, because when we're busy, we do go into automatic mode. So if you're more aware of your hot button issues, you can pause, um, ask a question, listen more for these hot button issues. And your auto response can be whatever. Thanks for sharing your concerns. What? Just try to come up with a question you can always ask. The easiest one is just tell me more about that. Um, you can use that for everything. Tell me more. And it's much more effective. It engages, it builds trust with the patient, client, whoever you work with. Again, so now we're going to get to the ors. So the first thing is just try to use more open-ended questions. Try to remove these yes, no. Again, our spirit animal is Curious George. We're going to be curious. Tell me more about that. What do you like about exercise? What kinds of foods could you eat that are healthy? Whatever you're talking about. Um, you can come up with your own questions, but the point is you need to engage in conversation, and open-ended questions are the magic to that. Okay, so again, curious, open-ended questions. Number one takeaway from this talk. So we're moving up the skills of MI. The next one's affirmations. And this is like giving a person a pat on the back. You're recognizing value, strengths, effort, skills in the conversation, which can be difficult. But if you can just, once in the conversation, I'll be like, oh, you really value personal choice. You really want to prioritize, keep your kids healthy. It's clear you really care about your child's health. Give them a little pat on the back, because again, they're trying to do what's best, what they think's best for their child. And if you work with other issues, behavior change, oh, that's great. You started working out, recognize them and give them a pat on the back if you can in the conversation. Again, therapists, counselors, really good at this, but if you can do this, it just builds more trust, engagement, and it makes the MI more effective. So there's some examples on here. I'll just read one. The parent, I just want to make sure I'm doing the right thing for my child. So it's clear how much you care about your child's health in making a thoughtful decision. Pat on the back. So just think about, how can I give my patients, clients a pat on the back in our conversations? So I'm worried about the MMR vaccine, but I also don't want my child to get measles. So affirmation, oh, you really value the health of your child. You're trying to do the best thing. Whatever it is, a little pat on the back. Try to throw these into your conversation. Again, a little harder, but again, it builds more rapport and connection with your patient client. And then the another higher level skill is these reflection summaries. And basically, you want to just check maybe once in your conversation. I know how busy you all are. Just do a reflection or a summary to confirm that you heard them correctly, and it shows the person you're listening to them. Really, that's what it is. And in these reflections, you really want to focus not on I hear you saying, I feel, on a you statement. Oh, you told me you're struggling to change your diet. You are worried about the side effects of the vaccine. You want to ensure your child doesn't get autism or any side effects. If you can say the you, it improves the conversation again. So just try to reflect, even if it's at the end of your conversation, just once in your conversation with patients, if possible. It makes them trust you more and they're more likely to accept your recommendations. So again, you just reflect back. The patient says, I don't think my daughter needs the HPV vaccine because she's not sexually active. You could say, you're saying you don't think the vaccine is necessary because she's not sexually active. You could literally just repeat it back. You can add more context or whatever, but if you can throw these in, again, it strengthens the whole MI process. I'm just going to skip this for time because I want to get to the other key takeaway. So we went through ORs. Again, Curious George, spirit animal, open-ended question, try to do affirmations, reflections. But this is the other key thing I want everyone to focus on. Maybe try to practice this today if you're seeing patients, clients, whatever you're doing. And it's the ask, offer, ask. This kind of has MI built into it. And you can follow this script here exactly how it's written. We have a handout I'll make sure to send over. But I'm just going to give a dumb example before I go through this. Let's say I'm wearing a hot dog suit. I'm in New York on the street. I'm handing out coupons for a hot dog stand. And people are walking down the street and I'm just shoving these flyers at them. Here, take this. Here, take this. The likelihood of people actually looking at it when I'm not engaging them, I'm just shoving flyers in their face, is basically zero unless they really love hot dogs. All those flyers are going to go in the trash or the garbage. But let's say I'm the same guy in the hot dog suit and people come down the street and I ask them a question before I shove the flyer. So I say, hey, what's your favorite hot dog topping? I'm engaging them. I ask them a question and they say, oh, I love mustard. And I'm like, oh, I love mustard too. Can I offer you this coupon for the hot dog stand? And if they say yes, it's following the script. I give it to them. And then you could be like, oh, are you going to try us out? If they do this process, they've studied this, not that exact scenario I'm going through, but people are far more likely to look at the flyer, use the flyer, whatever. And this applies to anything, any advice, recommendations, information, flyers, whatever we're giving people. If we engage people before we throw information, flyers, they're far more likely to use it or read it or consider it. And oftentimes we do this the other way around. We're the hot dog guy just shoving information at people. So this is the magic. If you only take one thing away, try to do this today. So let's say a patient comes in, they're due for a vaccine. So you can say, oh, what do you know about the vaccines your child's due for today? And let's say they say, oh, I know they're due for the measles and I'm kind of worried. Let- they give you some response. Then you want to reflect or affirm. Oh, you're worried about the side effects. You really care about your child's health. Let's work together to figure out what we can do here. Do you mind if I offer you my recommendation or some more information about these vaccines? Wait for them to answer. If they say yes, oh, you don't want to just start giving them tons of it. Don't overload them. Try to, one short, concise, clear piece of information. I would really recommend you get your child vaccinated because of this. Like short, it's the safest, best way to protect their health, whatever you want to tell them. And then you can say, what do you think? Do you have questions about this recommendation? You want to ask that follow-up question. So this has MI built into it. Hopefully you all can remember this. Never give people unsolicited advice. Fly, even the front desk people. You can do this across your whole clinic. we shouldn't shove information at people without engaging them. Unless we want it to go straight in the garbage can, it's a waste of paper, you know. But if we engage them, ask for permission, kind of do this condensed, easier MI, ask, offer, ask, it'll have far more likelihood of helping them accept information and maybe change behaviors over time. You know, most people, it might take multiple times. Okay. I know we're getting close on time. I want to leave a few minutes for questions, but I'm going to just touch on a few last things. So we live in this confusing time where the government's changing a lot of things, and what vaccines are even covered by my insurance? What is the recommended schedule? People are very confused, and yeah, it's just very confusing. So I'm going to go through how you can use this ask, offer, ask if you want to explain the changes in the vaccine schedule, and how to link it to the AAP recommendation, which is the original one, or whatever your clinic's doing. Here's some of the key talking points. So in the ask, offer, ask, this is where you will offer, you know, like the science hasn't changed. We're sticking with the AAP schedule. It provides the strongest protection when the immune system responds best. Whatever, you can read through these later, or you can come up with your one talking point for your clinic. And you don't, I'm not a doctor. Your clinics can decide what you want to do. That's all up to you all. So if we're using the ask, offer, ask, here's how it could work. What have you heard about the vaccine schedule changes? You know, the person's like, oh, it's so confusing. I don't even know what my child needs anymore. You know, they say something, you're, oh yeah, it is confusing. You're really confused. Everyone's confused. Can I offer you, um, you're hearing different messages. You want clarity. Can I provide some more information about the schedule? Yes. You can read one of these. The science hasn't changed. AAP supports the original schedule. And this is what I recommend. And then again, ask, offer, ask. You do want to ask the follow-up questions. What questions does this bring up for you? A follow-up to keep engaging them. So I know you're all busy. So using that example above, or using the ask, offer, ask, how can you kind of triage which patients you should spend more time with? So like the people who are going to accept your recommendations, you don't have to do a ton of MI because they're already on the same page as you. Just be polite, you know, ask them, do you have any questions? Are you worried? Get them their vaccines or whatever their behavior change. You want to spend the majority of your time on these yellow patients. And you can kind of identify these yellow patients as anyone who has like core beliefs, religious, if it's tied to their religion or some core belief, it's really hard to change those beliefs, and we shouldn't really try to do that. So if you know that group, they're kind of in the red. The other people that will be moved to the red, if they just have extreme views and you kind of know they're red, that's fine. But when you do the ask, offer, ask, when you offer, oh, can I offer you my recommendation? If they're kind of, oh, okay, I guess, you know, like hesitant about hearing your advice, or they say no, they go to this red. Like, don't waste a bunch of time using MI. If they're really hesitant on even letting you explain your point of view, they're going to be down in this red. If they're like, okay, sure, I'll hear what you have to say, they'll be in this yellow group. So spend about 2 to 5 minutes asking them a few questions, going through the ask, offer, ask. Again, the green, you already know. You don't have to spend tons of time on those patients. Okay, so these are references. There's links to videos watching people do this, MI. And then we have this post-evaluation. If you have time, I would appreciate it if you do it. It just helps with our grant reporting and writing new grants. So I'm going to put this in the chat, and then I'll answer any questions. I know we're close on time. Yeah, and if you could throw your questions in the chat or come off mute, I'll be happy to answer. Hopefully this is helpful.
I'm going to ask a question for the group, Erin, because we talked about it in our last meeting about what kind of approach, I don't know if you can think of something off the top of your head you could use to help move people along in levels of care when finances might be a barrier. So
Oh
encouraging
yeah.
people to seek additional care um, if, insurance doesn't pay or they don't have the resources.
Yeah. So you can use this with anything. So if like there's some things out of people's control, right, that they can't actually change, and if they view this as something they have no volition to change, it's harder. But let's say, if they don't do it, they're going to get sicker, right? Or it's going to be worse. So you could kind of steer the question that way. Um, but you want to use MI, so it'd be like, oh, I see you're delaying this, care because of financial. And it could be, can you tell me like what you've tried so far? Um, have you tried to get, financial assistance and and you're not all the experts, or have you talked to our social worker just to get the conversation going? And then you would want to say, like, what will happen if you don't get this care you need? What are some of the things that might occur? Because you want them to think about, oh, I might end up, getting a hospital bill that's $1 million or something from the ER, that whatever they say to you. You want to ask a couple of questions, getting them to think about the negative and positive uh, impact of getting that care. So, like, what you can say, what are the pros and cons of, not getting this care? Just to get them thinking, and then and then another question, like, what would help you consider getting this care, even if it costs you extra money, um, or what would motivate you? So it's really just engaging them in those questions and listening, because they have to, again, you can lead a horse to water. They have to come to this decision on their own, and they have to find what will work for them. Does that make sense? I would try to steer it towards, what will happen if you don't? What could happen to you? What could happen to your family? Et cetera, like those types of questions.
Great, thank you.
Anyone else have questions? I know I talked a lot. I was trying to go through that quickly. I'm always happy to answer questions. I'll send all my stuff to Athena. We created a couple new flyers. I don't know if I sent everything to you, but I'll send that all over to you right now.
Great, thank you so much, Erin.
Yeah.
Um, as we wrap up today, I just want to remind everybody that our next meeting in March will be on the third Wednesday of the month. I believe it's the same date. I think it's March 18th. Um, and our topic for that day will be community factors that influence health, also known as social determinants of health. So we'll be learning a little bit more about that. And that is it. Thank you, everybody, for your time today.